Hello everyone, I am Dr. Ratnav Ratan, Consultant Paediatric Orthopaedics and Sports Injuries at CK Birla Hospital, Gurgaon. So today we will be talking about cerebral palsy. What is cerebral palsy? What are the symptoms? How do we approach a child with cerebral palsy? What are the paradigm shift in the management of cerebral palsy, and what changes have occurred over the period of time in cerebral palsy? So cerebral palsy is a permanent disorder of brain which causes movement and posture disorders, and it is usually a result of a permanent brain damage, and there is a static encephalopathy which precedes the symptoms of cerebral palsy. So the most common reason which causes cerebral palsy is a delayed cry at the time of birth, which causes lack of oxygen to the brain for few seconds or minutes, and that causes a damage to the white matter of the brain. So that usually over a period of time leads to symptomatology of cerebral palsy. Now this damage is usually doesn't progress beyond a time, and it's a static encephalopathy. So it is one of the commonest cause of childhood disability seen world over, and there are about 30 million kids with cerebral palsy currently in India, and approximately 2 to 3 child every 1000 live births end up with cerebral palsy. So it's a big economic burden for the parent, for the family, and for the nation as a whole. So we need to understand how to approach these kids, have an early diagnosis, early intervention, and to integrate them into the mainstream of society. So there are few important facts which needs to remember. It's a lifelong disability. The disability may increase as the height of the child increase, and to an extent when these CP kids end up with in adulthood have an early aging as well. So that's how broad the spectrum of involvement is. Now parents, when they come up to us with their child in early infancy, the most common question is, when will my child sit, when will my child start walking? As the child grows, they'll say, when will my child start talking, when will they start integrating with the other friends, with the peers, how will they ever have friends and relationships? As the child further grows, there are questions about their independence, about their job opportunities, about their marriage. As the child further grows, becomes an adult, middle-aged adult, there are problems related to secondary problems because of sedentary lifestyle or because of inadequate movement. So they may end up with many non-communicable diseases as well. So a lot of things have to be taken care in the comprehensive management of a cerebral palsy person. Now we usually classify cerebral palsy based on the type of movement which we see in a child. So it can either be a spastic type or a dyskinetic type. Spastic type usually have very tight contracted muscles, and dyskinetic kids can have achoria, athetoid, or ataxic type. So in short, they have abnormal involuntary movements over which the child doesn't have much control, and they also have lack of balance in the ataxic type. It really depends on the type of the area of brain which has been damaged. So every part of brain has a different function. So motor cortex damage will lead to more motor problems. Damage to the basal ganglia part will lead to more of dyskinetic type of cerebral palsy. Cerebellum damage will lead to more ataxic type of cerebral palsy. Then it can either involve one limb or one side of the body, or both lower limbs, or both upper limbs more than the lower limbs. So this is how we classify depending on the the clinical type, the anatomical type. Then again, it can also have a non-motor presentation. Doesn't always mean that a cerebral palsy child will only have motor problems, as in problems with the limbs and the legs, or difficulty in walking, trunk, balance, etc. So they can have a lot of non-motor problems, as in behavioral problems with their cognition, behavior with their problems with their speech, with vision, with hearing, with swallowing, with continuous drooling. They may have diminished reflexes, oropharyngeal reflexes. So there are a lot of non-motor problems which usually accompany these kids, and sometimes 40% of them may even have mental retardation. 60% of them may have additional episodes of seizure disorders. So all that have to be taken care of in a multi disciplinary approach. So not, one specialty cannot manage cerebral palsy, on its own. So when we clinically assess a child with cerebral palsy, we need to assess if what category does the child fits in, whether it's a spastic type or a dyskinetic type, whether there is an associated intellectual problem, where there is an associated vision or any other sensory problem, whether the child is able to manage his daily chores on his own. Now we also need to see the social aspect of all these problems, because it's an economic burden for the family. It's difficult for these kids to integrate with their peers. They may have challenge making friends. So these all things have to be taken care of. A holistic approach to management of these kids have to be a designed and a goal-based approach is used to manage such children. So there has been a paradigm shift to the management approach of these kids. Of course, aim is to prevent them. Prevention is a very important aspect. If we can prevent such happening of such brain damage, so a proper antenatal care, care during the delivery of the child, steps to prevent birth asphyxia, timely cesarean, steps to prevent meconium aspiration. All these will lead to a lower incidence of cerebral palsy in children. Then, if at all a child is already suspected to have cerebral palsy like symptoms, so traditionally we do not make a diagnosis of cerebral palsy before 2 years of age. So, but over the years there have been many new classification systems, new methods of motor assessment, where we can make the diagnosis as soon as 4 to 6 months of age. General movement assessment of the child. Then there are neurological symptoms, neurological grading systems like Hein and other advanced scoring systems, which help us give an idea that this child may land up with a cerebral palsy at around 2 to 3 years of age. So this basically helps us in starting an early intervention. So the next step is early intervention. So early intervention is an integrated approach to a child where every aspect of the disability is taken care of. The shift has been from a child-centric approach rather than being a therapist based approach. Then focus is not on a lot of exercises. It is the aim is to make the child play, to make the child be active, to teach the child to learn these developmental the milestones, the fine motor skills while they play, while they take bath, during their toileting activities, during their meal time. So this basically helps them to have fun with these therapy activities. So that is how important is early intervention, and we are these days emphasizing on a home-based approach. Because of the pandemic, not every parent is comfortable bringing the child to a rehab center for a comprehensive evaluation and a daily treatment. So we have now moved to a home-based therapy where there are online classes for the parents, how to teach them what gadgets to use, what props to use at home, so that every child, based on their developmental milestone, is taught a goal-based approach, a strategy is developed for every child, so that we focus on the abilities of the child and not on the disabilities of the child. So the principal aim of a home-based therapy is to make the child focus on his or her abilities, to make the child learn those skills during the early years of age. So less than 4 years is considered to be the golden period, where there is the brain is growing. So what we use the term neuroplasticity. So when the child is taught these fine motor skills, social skills, sensory stimulation is given, the damaged neuron is overtaken by the latent neurons in the brain, and a lot of disabilities can be overcome in these early years. So as it's better to start these early intervention techniques as early as feasible, so that we can take advantage of this golden age. So of course physical therapy takes precedence over everything. Now there can be many home-based modalities where we teach the child to balance their trunk, to balance their neck, help them sit with multiple bolsters or pillows or CP chairs. Now there can be sensory stimulation with torch, or with bell, hearing stimulation with bell. There are various ways where all these problems of the child is treated in one setting. So we try and integrate the motion, the motor stimulation, the communication skills, the speech problem, the vision, hearing. All of them is integrated into the fun activities of the child, the daily living, the activities of daily living of the child. Try and teach them when the child takes bath or goes to toilet or has their meal. So along with that we also advise, depending on the type of spastic muscles, the tight muscles or contractures, there is add-on bracing, which plays a very important role to prevent joint problems, later on permanent joint contractures. So bracing in the form of ankle foot orthosis, walking aids for children who are unable to balance themselves. So they also play a very important role. Then sometimes the spasticity is so much that we are unable to control the tone only with rehab. So the rehab again needs to be supported with proper casting techniques. Tone inhibitory casts are used to decrease the tone in the child. Sometimes all these doesn't help, and we need to add other forms of treatment like botulinum toxin injection into these spastic muscles, which helps to temporarily relax these muscles. They have an effect which lasts for 4 to 6 months of age, and during that time proper goal-based therapy can help to strengthen the antagonistic muscles and help gain strength in the weaker antagonistic muscles. So this basically helps to improve the gait, the function, the fine motor skills of the hand, and it takes brings a lot of difference to the functional abilities of the child. Now sometimes we also add oral medications to decrease the tone. The only disadvantage is that they also act on other muscles, so the child can become floppy, can become drowsy. So those has to be adjusted for these kids. Now other recent advances in the therapy of these kids are electrical stimulation of the muscles, so that the muscles are stimulated to take over to increase their strength and to increase their power. So if the muscles are painful, we can add on transcutaneous electrical nerve stimulation techniques, TENS. Now different other modalities have been integrated into the neurodevelopmental therapy like mirror therapy, then there's a sensory integration, sensory stimulation, then bimanual therapy, then constraint induced manual therapy. All these manual methods have been introduced, have been found to be really useful in helping the child develop their skills. Now we also focus on integrating them to the normal schools. If the child is able to sit and stand, has a basic handwriting writing skills, so we prefer admitting them to a normal school. We also teach them yoga, especially the yoga especially useful for dyskinetic kids who have a lot of involuntary movements. So other modern techniques like hydrotherapy, all these help in basically develop the motor skills, the fine motor skills, and as well as integrate them with the normal the peer group. So simultaneously a neurologist takes simultaneously we need support of a neurologist for seizure disorders. We also need to take help of therapists, as we discussed, neurodevelopmental therapist, occupational therapist, physiotherapist. For the Botox and the surgical part, the pediatric orthopedic surgeon is required. So all this have to be taken care of, has to be managed. There is an intensive phase initially. Once the child plateaus, has a good function, it just needs to be maintained. So the most important part for cerebral palsy management is that the intervention and the rehab part needs to be continued till maturity, approximately 16 to 18 years of age, and so that we don't lose the benefit we have got, right? So really sometimes 10% of kids who are more severely affected, the more disabled kids, sometimes require additional surgical procedures in terms of rotation of the bones, cutting the bones, putting in the hip. If the hips are going out, sometimes the bone develop permanent deformities, rotational deformities. The tendons becomes extremely tight, so they may need to be lengthened. So all these, sometimes the spine gets deformed, so we need to correct the spinal deformities. So these are rare surgical intervention which may also be required in a cerebral palsy kids. So to summarize, we need to understand that cerebral palsy is not a disorder, right? It's a spectrum of movement and posture problems in a child. There have been a lot of changes in the way we manage these kids now. as we said, the focus is now on child stability. The focus is on activities and not exercises. They have to be made fun-filled. The children have to be encouraged. The parents needs to have a lot of patience managing such kids. Every milestone which is developed, every game the child plays needs to be rewarded. The child should feel encouraged after doing any kind of exercises. If the child fails to do exercises, we should not lose our patience with them. So that is how we manage a cerebral palsy kid in a comprehensive way and integrate them to the mainstream of society. Thank you.